that Italy is
tumbleweeds. And no fans means no customers at Jenny's Pizza, a new place on Prince Street. How bad is this for you?
It hurts because, especially as a small business, and especially us, we've been open like 4 months down here in our first retail location. It hurts a lot.
When the NBA and NHL suspended play, it wasn't a ripple effect around the Garden. It was a tidal wave.
โอ้เต็งร้านอาหารไม่มีคนเลย
ไม่มีร้านไทยไม่มีข้าวขายแล้วมันจะขาย
Now the lunch crowd is it.
it is definitely going to hurt us. We're right towards the end of our season. We still have a lot of games to go, but I feel like there are so many other people that have really been hurt by this.
10 minutes, Tyler.
Coors Boston has been on Canal Street for 44 years, a true sports bar.
สปอร์ตบาร์นะจบเลยนะ
Was shaking elbows with a few customers today and trying to figure out how to keep the staff working.
The economic impact will hurt. You go from a full staff of employees down to 5 or 10 tonight, and you don't know what the fans are going to do. They're still going to come on and watch the March Madness games next week.
And now, March Madness has been canceled. I guess we're in the middle of a sports wasteland now. But I guess it has to be done. In Boston, I'm Bill Shields, CBS in Boston.
Well, tonight, CBS Evening News anchor Nora O'Donnell spoke with the filming in Australia. Hank says they got tested because they were feeling fatigued and had chills and slight fevers. The celebrity couple is now isolated at a hospital in Australia.
Look, I can't comment on the specifics of the cases because there are privacy issues, and that is a matter between the patient and, of course, the treating physician. But what I will say is that 8 people have been treated for coronavirus at this hospital and have been discharged in the past. So I'm very confident that we have world-class doctors that are determined to look after them and give them the best possible care.
Australia, by the way, has had at least 120 cases and 3 deaths from coronavirus. Hanks and Wilson will remain at a hospital on the Gold Coast of Australia until they are given the all-clear. Well, tonight, Canadian Prime Minister Justin Trudeau and his wife Sophie are self-isolating because Mrs. Trudeau recently returned from the UK and has had flu-like symptoms. The Prime Minister says they are awaiting coronavirus test results. Canada has reported more than 100 cases of the virus. Starting next week, late night tested and failed. Well, this happened last night as her symptoms worsened. Tonight, she is home in self-isolation, but still without an answer. David Wade has her story from Boston.
Started feeling like a tickle in my throat on Monday.
But Hillary King didn't think much of it at first. She's talking to us from her North End home where by Wednesday, she was worse. A nasty cough and shortness of breath. So she called her health insurer.
They recommended that I go to urgent care or the ER.
So she called the closest hospital.
After speaking to somebody at the ER at Mass Gen, they told me to come down.
They immediately gave her a mask.
Chairs for the patients were spaced out, 6 feet apart in all directions. They listened to my lungs. They said it sounded clear. They took my temp. No fever.
But her cough was bad, and she says her doctor wanted to test her for coronavirus, but couldn't do it because she didn't meet the criteria. She hadn't traveled to a hotspot overseas or been in direct contact with someone with a confirmed case.
If you don't meet one of those, then they will not test you right now because they only have so many tests, and they're saving them for folks that do meet that criteria.
Hillary was eventually sent home, where she plans to stay alone for at least 14 days.
It's really scary to think about, how, I could have been asymptomatic but contagious. And, that's why I'd really like to know and get tested and find out if that's what it is.
Now, to be clear, doctors can request that a patient be tested, but the final decision is made by state health officials, and obviously in this case, they didn't think that Hillary met the criteria. I'm David Wade for CBSN.
Pantries and refrigerators are stocked. Hundreds packed at Costco and
โอ้โหเต็งดูแถวยาวคอสโก้
Aerial footage shows the line of customers.
เนี่ยแคลิฟอร์เนียเต็งดูแถวคอสโก้ดิ
Local police did respond to help ensure
ป้าเต็ง
Well, the travel ban that President Trump
แถวยาวเป็นงูเลยออกมานอกที่จอดรถเลยอ่ะ
mainly among people who are racing to get on a flight to the U.S.
กัน
before the ban takes effect
ยุโรป
Friday at midnight.
บ่มีแล้ว
Hager reports from Logan Airport in Boston.
I'm so relieved. I'm so happy to be here.
So very thankful. I've never been more thankful to be home.
Wanted to go home. I mean, I just wanted to go home.
President Trump's announcement of coronavirus-related restrictions on travel from much of Europe sent Americans there into a tailspin.
Everybody panicked and ran because it was hard because it was only on CNN. I was in Sweden, so it was hard to understand it. So we all just ran.
Both of our moms called and were like very scared, like we don't want like that flight to get canceled.
On the other end, people who planned European vacations are pulling back.
We are.
Masks littering the grounds, a sign of the uncertainty.
Definitely being back is like kind of a relief.
There was a lot of confusion about passengers in the terminal here about these new restrictions that take effect on Friday. They only apply to people who are not U.S. citizens and
เพราะว่าอย่างเงี้ยมันต้องถึงแบบทุกประเทศต้องปิดประเทศเพื่อจะเคลียร์คนของตัวเองไงไม่ให้ไปแพร่ที่ประเทศอื่น
CBSN, Boston.
Well, a lot of Americans are wondering whether all these measures are really necessary. Dr. Malika Marshall spoke with one of Boston's top infectious disease specialists to help us understand why these steps are so important.
Joining me today is Dr. Paul Sachs. He's a professor at Harvard Medical School and a doctor at Brigham and Women's Hospital, and he specializes in infectious diseases. Thank you so much for coming.
You're welcome. It's good to see you again.
I know.
You're Dr. Marshall from your residency.
That's right, residency at the Brigham. I trained under you. He's a very, very smart doctor. So we talked a little bit about social distancing, and I know that there are still people out there who sort of poo-poo this whole thing. It's much ado about nothing. Why is social distancing such a good idea?
It's important for two reasons, both for your personal health, because it means you're less likely to get exposed to the virus, but also for the benefit of others. Because when we spread the epidemic out, when we so-called flatten the curve, we reduce the stress on the system, and the system really can't take too many extra sick people at any one time. So it's very important that we do it both for ourselves and for society.
And you're recommending it for everyone, not just people at high risk.
We are recommending it for everyone, but in particular for those at high risk. You know, it does sound like such a loss of freedom to tell people, you know, you really shouldn't go to concerts, you really shouldn't go to closed spaces, you shouldn't go to restaurants and bars, but that is the advice we're giving people right now.
Okay, so earlier in the crisis, we were reminding people that the flu has been killing so many more people here in this country than coronavirus did at that time, and certainly does now. But maybe we went overboard because now everybody's like, it's just like the flu. Why is this different from the flu?
So, you know, I like to start by saying it's not a competition. These viruses are not competing with each other. They're both potentially very serious. The flu, of course, we know there's this seasonal peak and then it goes away. This is a totally new virus coming into a population that is susceptible to it, and it's our population, and we are very much at risk of having the kind of exponential growth that they saw in China when it first appeared. So that's what's happening now in the United States, and we really have to be prepared. We know from the experience in Northern Italy that it's much better to be prepared ahead of time than to have to react to things as they're happening later.
There's been a lot of confusion about sort of contagion. When are you contagious? Is it possible to be contagious before you develop symptoms? And then how long after you develop symptoms?
Right. So we are, based on epidemiologic studies, people are at their most contagious when they're at their sickest. And when people look at how did it spread, it often spread within families or within tight closed workspaces. But there is some evidence that it might be contagious just a little bit before they start getting symptoms. But that people shouldn't focus on that. It's really the symptomatic cases that spread it to others, which is why it is absolutely critical that people not go to work if they're sick. Or if people are sick, that they stick to themselves in their homes. It really is very important because that can prevent community spread.
And people, when they're feeling better, they're probably less contagious, but studies have shown that they still can shed virus, but less likely to pass it on to someone.
That's right. I mean, the studies of some of the sickest patients show they can continue to shed the virus for 7 to 14 days. But you know, in general, when people recover from viral infections, they start becoming less contagious, and there's less virus to be spread.
As an infectious disease expert, specialist, are you optimistic? I know we feel like we've lost some ground, right?
Yeah.
But do you think that we can play catch up and make a difference? And
I think we can, and I have some optimism about it because I've seen some places that have responded really quite brilliantly. I think South Korea has done a wonderful job in accelerating testing, accelerating containment, and bringing the curve down in the epidemic. The same thing has happened in China after, of course, a tremendous outbreak there. But it's going to take a lot of community effort, medical community, non-medical community, public health officials, and really we should pay attention to their advice.
Cautiously optimistic.
Cautiously optimistic.
That's good. Thank you. Thank you so much for joining us, Dr. Sachs.
Thanks.
Really appreciate it.
As Meg Oliver reports, experts don't believe the virus is close to peaking, and testing remains a serious concern.
Tonight, America is shutting down as cancellations multiply across a wide swath of life. Professional hockey, soccer, and baseball stopped operations, joining the NBA, which suspended its season after a player was confirmed to have the virus. Cruise lines, Princess and Viking, are canceling upcoming sailings. Broadway is going dark through mid-April, and Disneyland parks in California will close for the month. Hundreds of thousands of students are out of school, and more soon will be. All public schools in the state of Maryland and Ohio will shut down next week. It's even a new world getting groceries. This is the line outside of Costco near Los Angeles. And Dr. Anthony Fauci of the NIH says we're even failing to get people properly tested.
The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
So far, only 11,000 tests have been done in this country, while South Korea is doing 12,000 a day. The entire state of California has just 8,000 tests for nearly 40 million people. Some don't even work.
The tests are not complete.
One person who did get tested took a JetBlue flight to Palm Beach International. Flight attendants found out during the descent that the passenger learned he had tested positive. Here in New Rochelle, the epicenter of the state's outbreak, a 1-mile containment zone went into effect today, leading to empty streets. The National Guard is...
Meg Oliver, CBS News, New Rochelle, New York. Tonight, a lot of families are sad about canceled vacations in the happiest place on earth. Disney World Resort in Florida is shutting down starting Monday morning through the end of the month. And as Meg Oliver reported a moment ago, Disneyland in California is also closing for the rest of March, starting Saturday morning. And Disney's cruise line will also suspend operations for the rest of the month. Disney says it will pay its cast members while these parks are closed.
Well, the administration's top infectious disease expert, Dr. Anthony Fauci, spoke with CBS News Evening News anchor